I could see the frustration on Mr. Pointer's face. I can't imagine how frustrating it would be to go from very healthy and active individual to not being able to speak or move part of your body.
They speak from knowing about illness.
It was a little disheartening to send her away without being able to say, this is what causes your seizure.
And tell about it through different eyes.
Of course, going into a room full of cancer patients is always disheartening.
But judging from her x-rays, she must be having more pain than others. She looks fragile and scared. Every day I am presented with difficulties like this, and I must make do with what I have.
What is he referring to there, do you think?
In class, they tell stories of family or friends through the eyes of a doctor or nurse. It's part of Vanderbilt's Center for Medicine, Health, and Society. Also supporting this year's class was an innovation grant from the Curb Center at Vanderbilt.
You know, this is kind of what we're investigating all along.
Dr. Scott Pearson, a surgeon at Vanderbilt University Medical Center, developed the class for undergraduate students planning healthcare careers. He says the patient's story is important.
So oftentimes we know about their illness, but we don't know about the person and what's important to them. If we know all of that, I think we can give them better care.
But at this moment, I could see a look of fear hiding in his eyes.
To make that point, guest physicians and professors talk about spirituality, medicine, and patience.
I took a deep breath, put on a smile, and walked into the exam room. "Hi, Mindy, it's so good to see you," I said.
Vanderbilt senior Rachel Bernstein's entry is told from a doctor's point of view, the patient, her cousin with breast cancer.
The moment my eyes met Mindy's, the glassy film covering her eyes shattered, as every sheltered ounce of pain, fear, and anxiety fell from her face and flooded her lap. I sat there, held her hand, and just listened.
The call came over, my partner and I sprinted out of the coffee shop and jumped into the ambulance. 12 blocks away, we can make it quick, I thought to myself as I turned up the sirens and pushed hard on the gas.
For Vanderbilt junior Matthew Goldstein, it's about his grandfather being treated by emergency responders.
We quickly arrived and found Mrs. Marino sitting on the floor with her husband, and he appeared unconscious and not breathing. A police officer arrived as we inserted an IV line into his right arm.
Dr. Pearson hopes what these students learn here will change what they become. They have already changed him.
They invigorate me in my medical practice because of their enthusiasm and their desire to just investigate and interest in patients.
Rachel heads to medical school in the fall with a new outlook.
This class really reminds you that every patient is an individual, and you really need to cater how you treat an illness to that patient and their perspectives on their illness.
Mrs. Marino embraced me before we walked out.
Matthew has one more year at Vanderbilt before med school, but already he has put the lessons into learning.
I work at a free health clinic in Nashville, and my first day, I had a woman come in and sit down and cry to me about her life and how she's worried about her life. And without this class, I would have been shocked, and I wouldn't have known what to do.
But as she was wheeled off, she turned around and in her woozy stupor smiled and said, "Doctor, thanks for making me feel better. I knew I had done my job."
And the lessons continue. For VUCast, I'm Barb Cramer.